Hi, and welcome to Do It Yourself Breastfeeding. I'm Robin Kaplan, an international board certified lactation consultant, owner of the San Diego Breastfeeding Center, as well as the host of the Boob Group podcast. Today we are talking about breastfeeding while pregnant. Now, there are many times when doctors or midwives may feel uncomfortable with a mom to breastfeed while she's pregnant. However, there are very few reasons why a mom would actually have to wean while she's pregnant. So the ones you want to actually look at would be if mom has excessive bleeding during her pregnancy, she's actually losing weight instead of gaining weight, or if she's at a very high risk for preterm labor. And if you have any one of these three things, you're going to want to speak with your healthcare provider, either being your OBGYN or midwife, to make sure that you are a good candidate for breastfeeding while pregnant. If you are, then there are a couple things that you might notice. So one thing you might notice is that many moms find that while they're pregnant and breastfeeding, that their supply tends to dip, especially in that first trimester. And so sometimes that can make the child who is breastfeeding a little frustrated, but then other times they could actually just care less and they just keep on breastfeeding. Another thing to keep in mind is that sometimes pregnant moms will find that their nipples are more sensitive. And so I've actually had some moms tell me that they thought they were over all this nipple soreness, and now that they're pregnant, when their child is actually feeding, they feel like it's like right when the child was born. And so as long as moms are able to continue to go through and continue to breastfeed and their child is not super frustrated, then they're actually, it can be wonderful to breastfeed while pregnant and actually lead into something like tandem nursing when their second child is actually born. All right, so here is our sweet girl. As you'll notice, the way that mom is sitting, she's sitting cross-legged. Some moms might find that they're just sitting on a couch, whatever's comfortable, with their legs over, crossed, how we're seeing right here. And the child is actually wrapped around her belly. So baby could be sitting upright, whatever's most comfortable for mom to allow her to have that space to protect her pregnant belly, but also make it so that when the child latches on, it's comfortable. The great thing about it is most moms, when they're breastfeeding while pregnant, they usually have a toddler around. So these are children that are not actually sitting there. We're not focused on how that child is actually latching, because they really are quite, they're perfectionists at it already. They've already figured it out. Another thing that can be really helpful while breastfeeding while pregnant is actually doing the sideline position. The difference between this, though, when you're pregnant, is that most pregnant moms find it is most comfortable to breastfeed in sideline position with the breast that's on the bed. And rather than coming over and leaning over with the breast that's up top, that can actually kind of be uncomfortable as mom becomes more and more pregnant. And so what she might find is after breastfeeding the baby in this side, she picks the child up, moves them over to this side, and then comes over this way and breastfeeds along this breast. So that's pretty much breastfeeding while pregnant. So thank you for joining us. If you would like to watch more of our YouTube videos, please visit our YouTube channel. You can also visit our websites, San Diego Breastfeeding Center, as well as New Mommy Media, to get more information about our articles and our podcasts. Thanks for hanging out with us on Do It Yourself Breastfeeding.